One of the things that I'd like to highlight is the fact that, and this is very important in relocation, is that the whole concept of cognitive disabilities is very culturally laced. And depending on where you're going, there may be a very different attitude towards a child's learning disabilities from the place one is coming from. And this may be because you're going to a place where there's a stigma attached to a child having a disability, and sometimes this is the case in a lot of developing countries. Or it may be that it is something different, such as a different approach to medicine or to child development. Just a couple of statistics to give you an idea of what I mean. So, for example, according to the ADHD Institute, we have a 2.2% worldwide mean prevalence of ADHD. In the U.S., 11% of kids are diagnosed with ADHD, and 7.7 of those take medication for that. By comparison, for example, in France, 1% of kids are diagnosed with ADHD, and of those kids, 0.46% take medication. Now, so kind of you look at the difference in those statistics and you say, okay, so what could cause that? Are children in the U.S. really so different from children in France? Probably not. So is it that we diagnose differently in the two different countries? Is it, that we kind of have broader parameters in the U.S.? By comparison, for example, in France, ADHD is seen as something that's a little bit more environmental. So a child is more likely to be treated through sleep therapy or behavioral therapy, family therapy, diet, and there's a bit more skepticism towards medication, whereas in the U.S. we have a different approach. There was a time, for example, when families going to a place like Japan, the medication used for ADHD, depending on what it was not even legal. And so that was something that families going there needed to be aware of. So that is sort of one thing for families who are relocating between countries to be aware of. And depending on, where they're going, it may or may not present an additional challenge. It will definitely ask them to be more open-minded in how they themselves think about it.